Good morning everyone. I am Aaleha Izza Baliwan from DSN 1A, and now I am going to do a return demonstration for neurologic and cranial nerves assessment. So the first thing that I will do is I am going to sanitize my hand to prevent the spread of infection. And then I provide the patient privacy. So I already closed the door and the window to minimize the embarrassment of the patient. And then I am going to identify and then explain the procedure to the patient. So good morning, Ma. I will be your student nurse for today. So today I am going to do a assessment of your neurologic and cranial nerves. So, for now, I am going to ask a question. So, I just want to ask for your cooperation. Is it okay to ask questions now? Yes. So, do you experience any headaches, ma'am? Okay. So, do you experience seizures or that occurs with involuntary muscle movement and sensory disturbance? No, ma'am. Okay. So, do you experience dizziness or light headaches? No, ma'am. Or any problems on balance? Okay. So, do you experience any numbness or tingling? So, have you noticed a decrease in your ability to smell or taste or in any senses? Do you have difficulty understanding when people are talking or? Do you experience difficulty in swallowing? Do you have muscle weakness or any loss of movements? So, do you experience any repetitive involuntary trembling, quivering, shaking, or other movements? Okay, so, do you experience any memory loss, ma'am? Okay. So, do you have family history of blood pressure, stroke, Alzheimer's disease, epilepsy? No, ma'am. So, do you take any prescription or non-prescription medication? So, I just want to ask, ma'am, if do you smoke? No, ma'am. Okay. Thank you for your for answering my questions, ma'am. So now I am going to do or assess your cranial nerve. So the first is I am going to assess the cranial nerve number 1 or the olfactory. So I am going to ask the client to clear the nose, to remove any mucus, then to occlude one nostril and identify a scented object that that I am holding, such as soap. So now I am going to take. So, ma'am, can you close your eyes, ma'am? Okay. So next is the cranial nerve number 2 or that optic. So I am going to use a Snellen chart to assess vision in each eyes, and then now I just want to ask you to stand and Okay, so the Snellen chart is 20 feet apart from the client. So, ma'am, can you please tell me what number can you read? 8. Can you read it, then close it? D, E, F, P, O, P, E, C. Okay, so for the other, cover your other eye. What number, ma'am? Number 8 again. Okay. D, E, F, P, O, P, E, C. So, thank you, ma'am. So next is I am going to ask the client to read a newspaper or magazine paragraph to assess near vision. Ma'am, can you please read it? Can you read? Okay, so thank you, ma'am. And then next, I am going to assess visual fields of each eye by confrontation. So, ma'am, I want to ask you to stand up again and then cover your other eye. And then I'm going to do it too. Then 2. Thank you for the other eye. 3, 1. Okay, so thank you, ma'am. So now, I am going to assess the oculomotor, trochlear, and abducent. So, I am going to inspect margins of the eyelids of each eye and then assess extraocular movements. If nystagmus is noted, determine the direction of the fast and slow phases of movement. So, now I am just going to inspect your eyes. Can you look? Okay, so thank you, ma'am. So now I am going to assess the pupillary response to light, direct or indirect, and accommodation in both eyes. So I don't have any pen light, so I am going to use the flashlight of my cell phone. So thank you, ma'am. So now I am going to do the 6 cardinal gaze. So, ma'am, I want to ask you to look straight on the ball pen. I am going to move this closer to the client's nose. So, next, I am going to assess the trigeminal. So now I'm going to test the motor function. So I am going to ask the client to clench her teeth, and then while I palpate the temporal and masseter muscle for contraction. So, ma'am, I want you to, can you please clench your teeth? Okay, so now I am going to test for sensory function. So I am going to so ma'am, I am going to touch your forehead, your cheeks and chin with the paper clip, and then please close your eyes and then tell me if you feel anything, and then tell me where is it, where do you feel it. So can you close your eyes, ma'am?
forehead, cheek, chin.
So now, for the test, corneal reflex. So I am going to ask the patient to look away, and while I lightly touch the cornea with a fine wisp of the cotton. So ma'am, I am going to... Okay, so thank you, ma'am. So now I am going to test the facial. So I'm going to test the motor function. So I am going to ask the client to do some facial expression. So, ma'am, can you smile? Can you frown and wrinkle your forehead? Can you show teeth? Can you puff out cheeks? Can you please purse lips, ma'am? And then raise your eyebrows. And then close eyes tightly against resistance. Okay, so thank you, ma'am. So now for the acoustic or vestibulocochlear cranial nerve, I am going to test the client's hearing ability in each ear, and then I'm going to perform the Weber and Rhine test to assess the cochlear component of cranial nerve. So, ma'am, I am going to whisper some words.
Baby, blue, paper, towel.
Okay, so the client got it correct, and then he heard it. And then now for the glossopharyngeal and vagus. So I am going to test for motor function. I am going to ask the patient or the client to open mouth wide and say ah while I use a tongue depressor on a client's tongue. So ma'am, I want you to, can you open your mouth and say ah? So now for the gag reflex, I am going to touch the I am going to test the gag reflex by touching the posterior pharynx with the tongue depressor, and I am going to check the client's ability to swallow by giving the client a drink of water if there's any abnormality. Say, ah, ma'am. So, as I observe, it's normal, and I am not going to check for the client's ability to swallow. So now, for the spinal accessory, I am going to ask the client to shrug the shoulder against resistance to assess the trapezius muscle. So now, ma'am, can you shrug your shoulders? And then I am going to ask the client to turn the head against resistance first from the right to the left side of the head. So, ma'am, can you turn your head from right to left? Okay, so thank you, ma'am. So, for the last, the hypoglossal, I am going to assess the strength and mobility of the tongue, and I am going to ask the client to protrude the tongue, then move each side against the resistance of a tongue depressor, and then put it back in the mouth. Ma'am, can you and then can you So thank you, ma'am. So so now I am going to assess the sensory system of the client. So now I am going to do a light touch with the use of the cotton to the patient. And then, ma'am, I want you to close your eyes and then tell me or say yes if ever you feel the light touch that I'm going to do. So, can you close your eyes, ma'am?
Yes, 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 yes.
Okay.
Yes, 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 yes.
Okay. So next, I am going to test the temperature of the client. So, ma'am, again, I want you to again say yes if you feel the coldness of the object. Uh, say cold if ever you feel it. Okay, so close your eyes, ma'am. And then
Cold, 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 cold.
okay, so now I am going to test if the intensity changes. So, ma'am, does the intensity the cold intensity changes?
No, 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 ma'am, no.
Okay. So now I am going to test for the pain sensation of the client. So I am going to use a sharp object to test the pain sensation of the client. So, ma'am, if you feel the sharp, if you feel sharp, just say sharp, and then again close your eyes, ma'am.
Sharp, 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 sharp. Sharp, 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 sharp.
So I am going to again test the same sharp intensity. So
Sharp,
does the sharp intensity change, ma'am?
no, ma'am. No. No, no.
Okay. So now I am going to assess. So since we don't have vibrating fork, I am let's proceed to the assessing of proprioception. Now I am going to move the fistal phalanges of the thumb and the toes of the client. So I am going to wiggle it, and then ma'am, identify if it's up or down. So, ma'am, can you close your eyes?
Up, down, down, up, up, down, up, down.
So now I am going to test for the graphic seizure of the patient. So I am going to draw some objects on the palm of the patient, and then I am going to let her identify what I am drawing. So now close your eyes, ma'am, and then identify what object I am going to draw, or shape, number, or letter.
Heart, circle, 1,
Okay.
3, 4, 7.
Okay. So now I am going to assess for the stereognosis. So I am going to give the patient some objects. I am gonna let her feel it and identify it. So ma'am, can you close your eyes and then identify what object is this?
Paper clip. Coin.
So now I am going to assess the bilateral light touch stimulation. So I am going to ask again the patient to close her eyes, and then I am going to ask her where she feel my touch. Is it from the right side or the left side or the both side? So ma'am, close your eyes. Then
Right, left, left, both, left, right, both.
okay. So now I am going to assess the balance. So ma'am, can you please stand up, and then feet together, and then arms in the air, and then extend. So I am going to observe the balance of the patient. So, okay, thank you, ma'am. So now I am going to assess the cerebellar system of the patient. So now I am going to assess the gait, and I am going to observe the stance and stability of the patient. So ma'am, can you please stand and do a normal walk? Okay. So now for the tandem gait, and then please make steps. Okay, so now for the Romberg's test, I am going to observe the patient's inspect the patient's posture. now I am going to assess the speech of the patient. So I am going to utter some words, and then I am going to ask the patient to repeat the words that I am going to utter. So ma'am, I am going to utter some words and I want you to repeat after me. So champion, champion, hippopotamus, hippopotamus, flower, flower. So next is I am going to assess the nystagmus of the patient. So ma'am, I want you to follow my fingers and with your eyes. So now I am going to assess I am going to do the finger to nose test for the client. So ma'am, I am just can do this. Look into my eyes. Okay. And now into the other hand. The other hand, ma'am. Okay. So now I am going to assess for rebound phenomenon, and then ma'am, you extend your arms and then close your eyes. Okay. So now I am going to assess the tone of the patient's arms. So I am going to, ma'am, can you? So next is I am going to assess the knee reflex of the client by tapping the knee of the client. So now for the heel, so this diadochokinesia, I am going to tap. Ma'am, I want you to do the same thing that I will do. So and then on the other hand. And then on the other hand again. Okay, so thank you, ma'am. So now, lastly, for the heel to shin test, so I am going to ma'am, can you put your other. So slide it, and then on the other. Okay. So thank you, ma'am. So as I observe, as I do the assessment, I didn't observe any abnormalities. It went well. Everything was normal. Ma'am, as we do the assessment, I observed that it's all normal. And then, most importantly, thank you for your cooperation, ma'am. And then, that would be all for my written demonstration for neurologic and cranial nerves.